In today's video, we shall talk about HIV stage 3. And this is a severe stage characterized mainly by opportunistic infections like pneumonia, TB, diarrhea, and others. And this normally occurs because the viral load of HIV is always high in an individual. And also, the CD4 count is always low. Therefore, in simple terms, the immune system of an individual is always weakened. Therefore, we advise anyone and everybody to carry out HIV tests frequently. The earlier someone identifies his HIV status, the earlier the treatment is initiated and a better prognosis of HIV management is always achieved. So, in today's video, we are talking about the common signs and symptoms and the common diseases always observed in people having HIV stage 3. Remember we said it's a stage characterized by opportunistic infections. So I'll describe the common opportunistic infections significant in HIV stage 3, and they include the following. Number 1, unexplained body weight loss greater than 10%. For example, if an individual weighs 60 kilograms and out of the blue loses over 6 kilograms, that's to say 7, 8, 10 kilograms, and yet there is no correlating cause, for example, fasting, starvation, which is causing the body loss, then that individual should do an HIV test to identify. 2, unexplained chronic diarrhea for more than a month. Remember, high viral load causes HIV enteropathies, and this causes malabsorption in the gastrointestinal tract, thus causing chronic diarrhea. Therefore, people having diarrhea of unknown cause for more than a month should visit the nearby health facility and carry out an HIV test. The other, unexplained persistent fever for more than a month. Remember, fever is a sign of illness, and sometimes it's as a result of metabolic activities in the body in the reaction of the immune system against the invading pathogens. And therefore, if an individual has a high-grade fever for more than a month and there is no bacterial infection identified, there are no fungal infections identified, there are no other chronic illnesses identified, then that individual should be done an HIV test to rule out the possibility of an identified new HIV infection. Number 4, persistent oral and esophageal candidiasis. Due to the immune system being suppressed in HIV patients, especially those with high viral loads, their body immune systems are weaker, and therefore fungal infections tend to outgrow the normal bacteria. And therefore, people in this stage always have a persistent oral thrush within the mouth, and also they tend to experience esophageal candidiasis, which is uncommon in people who are HIV negative or people who are non-suppressed. Therefore, in the case of such signs and symptoms, an individual should be tested for HIV. Number 5, pulmonary tuberculosis. Remember, tuberculosis is another sign of opportunistic infection. According to Ministry of Health guidelines in Uganda, an individual or patient who tests pulmonary TB positive, that individual must do an HIV test. This is because pulmonary TB is common in people who are immune suppressed. And therefore, in the case anybody has the above disease, TB, an individual should do that test to rule out the possibility of HIV infection. And next, we shall look at oral hair leikoplakia. These are white patches with hairy things on the extremities of the tongue. That's on the sides. It's so uncommon in people who are healthy, and it's common to people who are immune suppressed. Remember, when it occurs, it spends there more than a month, and it's always caused by Epstein B virus. Therefore, this only happens in people who are HIV positive and with a high viral load with low CD4 count. And also, it can occur in other individuals who are immune suppressed. Therefore, in case such a sign is observed, please act immediately and take up a test. And also, we shall talk about unexplained anemia. Remember, anemia in HIV people is always caused by the malabsorption of nutrients from the intestines, especially due to HIV enteropathies. And also, high viral load causes suppression of the bone marrow, and hence few blood cells, red blood cells, are being produced. And in the end, this contributes to anemia, which might be megaloblastic, macrocytic, pernicious, or any other type of anemia. Therefore, individuals with chronic unexplained anemia should do several investigations, including HIV, to identify the cause. And lastly, we shall talk about severe gingivitis. Many people with HIV having a high viral load and CD4 count tend to have their gums affected, either by bacterial infections or they tend to get tooth decays. And therefore, such people should visit a health facility for assessment and management. There are other opportunistic infections which might be observed in this stage. But to make things better, in case you're sick, avoid self-medication. Visit a licensed health worker for investigations and management. And where possible, ensure to carry out an HIV test every 3 to 6 months in order to identify a new HIV infection as soon as possible. This helps prevent the poor prognosis in the management of HIV. Remember, the earlier, the better. And also, prevention is better than cure. Therefore, encourage everybody to participate in the preventive measures of HIV, which include A, B, C. That's abstaining from unprotected sex. B, being faithful to sexual partners. C, using condoms. And lastly, frequent HIV tests. Thank you, and see you in our next video when we talk about HIV clinical stage 4. Bye-bye.